eczema common in Malaysia? And the answer is a big fat yes. It's not only common, but it's getting more and more common over the last few decades because of a progressive urbanization, industrialization, and pollution. Look at the local data. Back in 1995, about 9.5% of the students in Malaysia suffer from eczema, but this figure increased to 12.6% in the year of 2001, and this according to the ISAC Phase 1 and Phase 2 study. And some of you might ask, how about in the year of 2021? Estimated around 15 to 20%. This is especially true in the major cities like KL, Penang, JB, and Ipoh. Means 1 of 5 students suffer from atopic eczema at certain point of their life. Have I overestimated this figure? I don't think so. I do have some data to support it. Firstly, let us move down to Singapore. Look at our brother and sister in the city of Malayan. They have almost similar genetic composition, almost similar exposure to our tropical climates and pollution. Yet they already achieved 20.8% about 2 decades ago in the year of 2001. And this is one of the studies that published in the British Journal of Dermatology. In Singapore, 1 of 5 students suffer from eczema at one point of their life. Moving on next, besides Singapore, besides Malaysia, how about other modernized community? Look at this table. Scandinavian country, Denmark, UK, Japan, Hong Kong, who have demonstrated a much higher prevalence of eczema compared with Sambo of China as well as Kota Kinabalu of Sabah. This suggests that extra hygienic daily practice does not prevent the development and progression of eczema. Chronic illnesses often complicated by myth and fallacies, and same apply to atopic dermatitis. One of the most common myth and fallacies about atopic dermatitis in my setting is food allergy is the cause of all form of dermatitis, include atopic dermatitis. As a result, many parents they get upset, confused, and frustrated when their kids around the age of 6 to 9 months old diagnosed with atopic dermatitis. Many of them directly relate the dermatitis to cow's milk, to goat's milk. Some in fact blame their own breast milk that contaminated by their own maternal diet. In no time they practice self-diet manipulation, hoping that by identification, removal, the eczema will get cured and then live happily ever after. And the second most common myth and fallacies in my setting about atopic dermatitis is steroid phobia. They believe that steroid is harmful, is poisonous. And just for your information, our body, our human body, we have 2 glands called adrenal glands. Every day it produces steroid hormone. So in other words, hormone steroid is natural, it's organic because it's produced by our own human body.
I have to sometimes scratch. It's just that I just try to not scratch so much. My parents help me. My parents help me telling me like try not to scratch, please. It will just make your skin worse.
is one of the strongest irritants for tropical kids. That's why if you look at the Masale, the Caucasian recommendation, they say, oh, you bathe your kids only once a day is the max, something like that. But it does not work in our weather here. Yeah. So whatever recommended by them is not necessary we practice it. To parents or people who have not experienced eczema before, often they consider eczema as something trivial, something simple and skin deep. But trust me, eczema is beyond skin deep. The inflammation, infection, and itchiness might cause not just physical but as well as psychosocial, mental, as well as the personality disorder among the kids, especially among the teenager. So bear in mind that eczema is beyond skin deep. Among the physical complications, the most common one among atopic eczema patients is secondary infections. And among the infection, bacteria being the most common, fungal is being the most confusing, and the virus called herpes simplex is the most dangerous and urgent, whereas another one called human pox virus is the most disturbing one in terms of cosmetic presentation. To manage children with atopic dermatitis, first of all, we need to understand the long-term natural cause of the disease. So in the case of atopic dermatitis, most of us are well aware that atopic dermatitis is not an acute condition. In fact, it's a chronic, relapsing inflammatory condition that takes months to years before they go into long-term remissions. So in this case, our primary aim is not immediate cure in 2 to 4 weeks, but is to flatten the curve, early identification of any minor flare, and act promptly and to stop it efficiently. And to achieve this, we need 3 groups of medication. The first group of medicine is physical medicine, means the cream, the oral medication, tablet, and injectable. So this patient with mild to moderate atopic dermatitis, most of them require a lot of moisturizer, a little bit of steroid, a little bit of non-steroidal cream like tacrolimus and pimecrolimus over the steroid sensitive area. Occasionally, they do need antibiotic if the eczema get secondary infected. Whereas for those with moderate to severe atopic dermatitis, they might need a form of oral or injectable treatment. Example of the oral treatment like cyclosporin, azathioprine, and methotrexate. And injectable, the only one that licensed is dupilumab, which is effective and safe. And the second group of medicine is in the form of knowledge. All the atopic dermatitis patient and caregiver need to attend an educational and empowerment program. So inside the program, we're going to empower them how to identify early eczema, how to act promptly at home to stop the flare, and secondly, how to recognize the environmental factors that might induce a flare, and thirdly, we're going to elaborate on what is eczema and actively debunk what is not atopic eczema. Means we need to debunk the myth and fallacies. This is important because this could be one of the major factors for poor compliance and poor treatment response. And lastly, the third group of medicine is psychological support, tender, loving care. And this is very important for the teenager, because the teenager, although physically they are strong, they have a strong heart, muscle, and bone, but psychologically they are fragile. They are fragile to negative comment, they are fragile to stigmatization in the school. As a result, they may end up with anxiety, depression, and lack of confidence. Without early detection and psychological support, again, may end up with poor compliance and poor treatment response.